This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to another edition of Health Watch here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, and yes, everyone is well today.
Oh, yeah, we're all here.
we're all here, and we're ready to go. Health Watch, of course, features Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. And if at any time during the course of the show you have a question or a comment for Dr. Molly, 855-839-1210 is the number, 855-839-1210. As always, we discuss the who, what, when, where, why, and how of Innovative Medical Associates and how it could potentially help you and your family improve your overall quality of life. And today is no exception. It's good to be back and well here on the show.
Oh, John, we're well. We were sort of well last week. It's just that I had three patients from out of town that all had to be discharged by Sunday, so it took a little bit out of Dr. Molly.
Yes,
to get it done.
Yes, it did. Yes, when you tell me you really can't do a show, then I know that.
That's right. That's right.
That's it. But tell us about Innovative Medical, and
Sure.
You mentioned patients, but we'll talk about that later. But what the basics of Innovative Medical?
Sure. Innovative Medicine is a group of like-minded providers, and we work out of my licensed primary care facility in Marlton, New Jersey. And what separates us, we can do anything. Well, let's start with that. We can do anything any primary care facility can do. If you need a prescription, docs can write for it. If you need radiology, we can send you out for it, and we send you out pretty close, actually, and pretty quickly. If you need a specialist, we can refer you to a specialist. But really, what separates us from other facilities is that we like to do everything with our eye on more natural products that can help reduce a patient's need for pharmaceutical products.
So it really is, I guess, a replacement in a way.
Some ways it can replace.
For the prescription meds, which have a lot of side effects.
Sure, and that's what we're trying to reduce. We're trying to reduce the side effects from most prescription meds. Now, we can't always replace every single prescription med, nor do we want to. We'll never tell a patient, throw out your prescription meds. You need help to reduce some of the medications, but we're fairly successful in helping people reduce their need for some prescription meds. So in many cases, we can bring the meds down. We can switch the categories with less types of side effects. So it really depends on what it is that what kind of challenge the patient has when they come in. And we do all this, John. This is the other thing that makes us a little different. We have found that the delivery of the natural products, things like vitamins, minerals, amino acids, maybe some homeopathics, even herbals, we're able to deliver these by hydration, medical hydration, and we find that that is a more effective way to reach a therapeutic level for most patients.
And why is that most effective?
Because it goes directly in, it bypasses your digestive tract, which many times you can lose somewhere between. We don't really know how much you can lose. Depends on the individual's physiology and that kind of thing. So it could be anywhere from 20% to 80% depending on the patient. So what we want to do, and why we found most natural substances have actually failed, is because we never get to a therapeutic level for that particular patient. And this is a way to do that, make sure the patient stays safe and deliver the therapeutic level.
Is that why people are skeptical about this?
They are, but they're going to find more and more the benefits of medical hydration outweigh any of the skepticism.
And I know you've talked about this before. You're different from a spa.
Oh,
I mean, there's a million of these spas
different.
around here.
One of the things that's really happened is a million of these have opened up. And when I'm talking about medical hydration, I mean medical hydration. You want to make sure that you're in a setting that is medically ready for any type of emergency. And I have to say that the naysayers, one of the things that has given us a bad name actually is how these things have popped up all over without any forethought as to patient safety, etc. And we're very conscious of all of those things. And of course, I'm also a stickler about what products go into people's bags.
And we should mention your background is a scientist. You have 2 PhDs, so you're no slouch here.
No, but I also have very good medical directors. And what happens here is, people think that, you can just walk into a place that does your hair, your facial, whatever. That's okay. If you're fine and you want to try that and you're one of the Hollywood stars and all of that, great, okay? But even they have had problems. Isn't that interesting? I just read an article about, I think, one of the Jenners or something. I don't know. She was taking a hydration at some place, and I don't know what the heck went wrong. But she ended up in the emergency room. But the point I'm making is, remember, it's still a medical procedure.
And you are very careful with the before. In other words, before someone gets
right. I want to know.
Treatment.
I want to know. That's why they must come to the free consult. We have to make sure that it's appropriate for them. You want to make sure that everything is appropriate for the medical hydration. You just don't come in and pick one from column A, one from column B, and we put it together like a menu. No, I don't want you coming in and telling us what you're going to get today. That's not for us.
And you also do blood work, right?
Oh, yes, on a regular basis. In fact, the new protocols are going in place for January. There's going to be a whole lot of changes, not really in philosophy or what you see, but behind the scenes, I have a lot more changes happening.
Say you sign up. This is your first time.
Sure.
And what do you expect? What should a patient expect?
Many times on the first treatment, they may not find a tremendous difference, but we're really looking at the patient's physiology and saying, okay, how do we safely deliver this? What's pressure pre and post? How are they doing? And do you feel any relief from your symptomatology? Most times patients say no, because what I am doing is testing their ability to maintain the fluid status, etc. However, it's interesting. People who come in with chronic conditions are generally what? Dehydrated. So the first trip makes them feel like Superman. And I have to laugh sometimes because I think, wow, if you think you feel this way right now, and then they tell me 2 drips later, well, I just don't feel that punch. No, because you're not as dehydrated. Now the real work begins on number 1 and 2.
Yes. How many treatments can people expect?
Well, I would say most...
In the beginning?
I would say most people... they can start to feel better in as little as 5 weeks, depending on how often they come in. And for most conditions, John, it's going to take longer than 10 treatments. I mean, let's be honest. It depends on where you start with me. But I have patients who see improvement in as little as 5 treatments.
Operators are standing by right now at Innovative Medical Associates, and you can reach them by calling 856-489-0505. That's 856-489-0505. When you call, the best thing you can do for yourself and for your condition or your problem is to make the appointment for the initial consultation with Dr. Molly. It is complimentary, and you will find out a lot about how she can help you. 856-489-0505 and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. A lot of good information on the website as well, so you want to check that out too. But do that and then call and make your appointment with Dr. Molly. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210, WPHT, the live version that is. 855-839-1210 is our number here in the studio. And we always tell you, call now so we can take plenty of time with your call and your problem. So 855-839-1210 is the number here in the studio. Dr. Molly, last week, part of the reason that we didn't do the show was Parkinson's patients. I mean, you were really...
I was inundated.
Yeah, you really were.
Yeah.
So how are they doing? And can you kind of give us an update?
And, I think it's important. Lots of times people tend to think of Parkinson's disease as the kind of situation that's very similar to MS. Well, in that it's a neurodegenerative disease, it is. However, in Parkinson's syndrome, I like to say, or disease, actually some of the underlying causes of it are unknown. It appears to be caused by the destruction of the dopamine-producing neurons in certain parts of the brain. Now, it's really characterized by tremors and muscle stiffness, rigidity, and problems with muscle control. So you've always seen patients like this, and people worry, oh, is it Lou Gehrig's disease? It can be mimic so many things. We have a caller, John?
Yeah, we're going to pick that up in just a moment, but it is our favorite caller, Frank in the Northeast.
Hi,
Frank.
Hi, Frank.
Good morning. Welcome to Health Watch.
Hi, Frank.
Good morning.
How are you?
Okay.
Good.
I loved your repeat last week. It was from 2 or 3 years ago. I didn't remember most of it. Every time I hear a repeat, I always learn something I forgot about. So it was nice hearing it.
Thank God. Thank you, Frank. And believe me, we don't like to do repeats, John and I. You know that. But it was very necessary.
I love them because I always miss something all the time.
You're very kind. You know what? You're just a kind soul,
And
my
you like
friend.
to hear yourself, right, Frank?
Nah, come on.
I can't because time I hang up, it's already played on the radio. There's not that much of a delay. But yes, I do. I miss the old radio cassette player where you could tape and record it. I can't do that no more.
You're the
Dr.
best.
Molly,
Yes.
I have a question. Food sensitivity versus food allergy.
Yes. Yes.
I just changed family doctors. My old one would not do a blood test for me for allergies.
Mm-hmm.
He did, and it came. No matter what I eat, 90% of what I eat, I swell up. I used to feel full of bloated years ago. The last 3 years, right. But now I had to test done. I swell up my face, my neck, my stomach. It can last 4 hours, sometimes until next day.
Yeah, sure.
Food allergy, it just showed cow's milk and shrimp. That's it. That's for allergy. Sensitivity, pretty much almost everything. The only thing there's no sensitivity is most fruits, most vegetables, most meat except for shrimp too, and all grains except for rye. What's the difference between a food allergy and a food sensitivity?
Well, the food sensitivity, quote unquote, should be less toxin on the body, but I haven't known that to be true. When people have multiple food sensitivities, which it tends to be, and a lot of this, by the way, has to do with the gluten, right? I bet you were high on the gluten. Yes.
No, I was fine.
You were fine on the gluten?
He tested for celiac and for food allergy.
No, forget celiac. Forget celiac. I'm asking, do you have a sensitivity to gluten?
Oh, sensitivity, yes. Allergy, no.
Yeah, that's right. That's what I'm saying. And you know how much of our stuff has gluten in it? A lot. So, yeah. So think about this, will you? Think about multiple sensitivities all coming together in one meal. Do you not think that's going to put the body in an inflammative state? Of course it is. You're going to have inflammation. And can that inflammation be terrible? Yes. And where does it start? Probably in the gut. And as we know, the gut, of course, goes right into what I'm going to talk about today in terms of the brain. So, of course, you're having a problem. So, in the conventional sense, people think sensitivities are insignificant, but they are not. And think about why. Because many times we have sensitivity to multiple types of issues, therefore, meaning multiple substances. Therefore, in any given period of time, you may be eating 1, 2, 3, 4, 5, 10 things that cause the body to react in an inflammative state. So if you have inflammation, what do you think? Global inflammation, you're going to feel like heck. So I agree with you that sensitivities, and I think your doctor's a smart guy. Many family physicians and general practitioners don't do that test because it's just cumbersome and it may cost out of pocket for the patient. But it is something that probably should be done if you have a patient who comes in with certain types of symptoms that really go to inflammation. So that's the answer, Frank.
Thank you so much, Dr. Molly. I consider you my primary care physician. You're the best.
Okay? I'm not a doctor. Listen, hey, Frank, I don't practice without a license. I do have a clinical license, as you know, But I'm not the doctor, but I have two good ones working with me. And
Dr.
I
Molly,
certainly...
you know a lot more than you do, okay?
You're too nice to me. God bless you, my
Thanks,
friend.
Dr. Molly. Thanks,
Thank
John.
you.
All right, Frank.
Bye-bye.
Thanks for the call.
That was a great call.
Yeah.
But yeah, I mean, when you think about it, and that goes right into what I'm talking about, these neurodegenerative diseases. So again, when we have Parkinson's or Parkinson's-like syndrome, where they haven't made a real diagnosis of Parkinson's, and how does somebody go about doing the diagnosis of Parkinson's? Well, you may do it by combining blood work, radiology. You might want to do a spinal tap as well as a muscle biopsy. And I have a patient right now who had the muscle biopsy that has mixed etiology to us. And my doc sat down with me and I looked at the pathology report, and I'm actually sending it out for an additional pathologist to take a look at the slides, but it just says that she has muscle inflammation. She has cellular inflammation. Well, does she have the symptoms of Parkinson's? Yeah, she has the tremors. She has the muscle stiffness. She has difficulty chewing. She has imbalanced, slurred speech. But what else she has is constipation.
Wow.
So, hallelujah, is our gut our little brain? Yes. And why does she have this? What are some of the causes? Well, in my mind, I think some of the causes can be environmental. It can be post-Lyme type syndrome. We sent out for a post-Lyme test that was very sensitive. She tested 2 positive bands for a post-Lyme bacteria, but she didn't test positive for what they consider in the traditional world to say that it would be definitely Lyme, which would be 3 or more bands. But you know what? She may be a highly sensitive individual. She may have some sensitivities that are also causing this brain inflammation or this neurodegenerative disease that is affecting her dopamine. So there's a lot that I have to look at with this. And what I'm saying is medical hydration can help this patient. It can help with the quality of life issues. And that's about what else they're doing out there anyway. They haven't, some of the medications have very severe side effects. And really, what we're doing is, even in the conventional sense, they're not curing Parkinson's.
You were telling me before the show that the earlier you're diagnosed, or the earlier the better.
Yes.
But how do you know? I mean, that's the question I have.
Well, how would you know? Well, I think the first thing, you have to pay attention to your body, and your people who know and love you have to pay attention. Are you having some falls? Are you having some unknown shaking? Are you having a situation where every once in a while you start slurring your words? And again, these are symptomatologies of many things. I'm not saying they're just the only things for Parkinson's, but I'm saying, what do you have to do? You've got to get in and have a good primary care doc to look at this and say, oh, well, let's send her out to neurology. And that's exactly what my patient did. Actually, she's in the early stages. It's an interesting thing. She came to me 6 months earlier, and she only had a couple of the symptoms. Now she has more. She came to me back 6 months later after going to the neurologist and having all those tests done. And now she's suffering with many more of the symptomatology. So my job now is to look at this and say, okay, what can we do? We have to address her mitochondria dysfunction. We have to address oxidative stress. And what does mitochondria dysfunction and oxidative stress have in common with everything else we treat? What? Inflammation.
Oh, yeah, there you go again.
So what do you think, since we're talking about this, John, do you think nutritional supplements might help her?
Yes.
Which one do you think would be the first one I would look at?
Vitamin C.
You got it. That's number one. But then there's some others. And one even more important maybe than vitamin C, but I'd look at vitamin C first. So what we have to do is say that if a patient is truly diagnosed with Parkinson's disease, it can be caused by multiple factors, and therefore it's not likely to respond to a single therapy, but rather focus our efforts on finding a plan that will help their quality of life, and that is what we do.
So in summarizing this whole case, where does it go from here?
Well, where it goes from here is I'm actually meeting up with the family. She did do a traditional treatment of something that was extracted from plasma, which I don't have an issue with. I think it's an okay kind of thing. It's called IgG. People know about this, and it's delivered IV. I do think there are many natural products now delivered IV that I think will have beneficial effects on her neurodegenerative challenges. So herein lies the rub. I also want to look at some environmental issues that might be causing this, because that will change some of the things I put in her bag. But one of the things I would definitely do right away is put her on my favorite repurposed drug, which is LDN, and utilize that in a subclinical dose. As you know, I've used this before because it can help with the dopamine receptors, and I believe that we have to look more and more to repurposing drugs as well as natural products, but again, using them in doses that are completely smaller than the doses they generally put people on.
So the dose would be appropriate in your mind or in your doctor's minds,
yes,
for this condition.
It will be appropriate for this particular patient. But we would also want to treat her with something called glutathione, which is an amino acid, as you know, one of my very favorite things. That is going to be her first IV treatment this week. When she comes back, I will be putting her on a dose of glutathione, and there is much data out there about this and the use of glutathione to help a patient with Parkinson's disease. Now, that's one of the amino acids that we use. But there are many more things that are anti-inflammatory in nature and also will help with this. For example, we might want to use things like grapeseed extract. There's some data to show that that will help. Resveratrol. One of the other ones that's very, very important is coenzyme Q10. Now, you know I've used this repeatedly, right? It's been very helpful in reducing the progression of Parkinson's disease, even in the conventional medicine. So when I look at this, I have to look at all of the data that's out there. And by the way, there's 112 citations of natural substances that can help a patient improve their quality of life in Parkinson's disease. Some of these things include gastrointestinal things that we might use because we believe, where's the little brain? In the gut.
In the gut, yes.
In the gut. And what's the thing that we look at for that? We have to look at the microbiome.
Okay, we are coming up on the halfway point of the show. Boy, time flies when you're having fun. It's the halfway point. Health Watch is the program every Sunday, the live version here, 8 until 9, right here on Talk Radio 1210, WPHD. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Got a question for Dr. Molly? 855-839-1210, 855-839-1210. Got some open lines, so we have plenty of time to talk to you, and we can really take the time to discuss your case right now. 855-839-1210. With Dr. Molly Fantasia, again, I'm your host, John DeMasi. We both return after these words. We are back here on Health Watch, and as always, operators standing by at Innovative Medical Associates, and the number 856-489-0505. Again, 856-489-0505. When you call, I'll tell you what you do. This is very, very simple. You make an appointment to sit down with Dr. Molly. It is complimentary, and that's where you really find out if this can help you or not. Most likely it will be able to help you, but you find out for yourself if it will be able to help you. So you just make that appointment. It's very, very simple. 856-489-0505. That's the number. And the website. And check that out before you make the call. Check out the website. It is innovativemedicalassociates.com. InnovativeMedicalassociates.com is the website. Health Watch is the show, Sundays 8 till 9, the live version here on Talk Radio 1210 WPHT. 855-839-1210 is the number here in the studio. 855-839-1210. We're going to pick up this discussion of the gut. It has the brain,
sure. Yeah,
the little brain.
Right. So the gut-brain axis is really what I'm talking about, John. And so one of the things I want to say is there's a two-way communication system between the enteric nervous system, or our second brain of the gut, and our central nervous system. So one of the very early symptoms, and this is compiled. In other words, people have Parkinson's. They're compiling statistical analysis, right? And they find out, like, certain areas of their life. They found out that chronic constipation has long been recognized, this is in traditional medicine as well, as an early sign of Parkinson's disease. It actually precedes the onset of the motor symptoms, okay? So there you go. This has to do with what? Now, from our perspective, once a patient comes in to see us, what we want to do is we want to talk about things like probiotics. We want to talk about enzymes for the patients because, again, what we want to do is we want to make sure that the gut dysfunction is straightened out and possibly eventually know that the gut is not contributing to leaky gut, which is when we have we have an inflammatory issue in our lower tract or our lower intestine. And it's very common in patients with Parkinson's to have something called SIBO. How many times have you heard that? SIBO, S-I-B-O, which actually is a condition of inflammatory bacteria or lower levels of the anti-inflammatories or small intestine overgrowth. So again, we see that patients who've had H. pylori, etc., can contribute to this leaky gut syndrome, which in turn may contribute to Parkinson's. I'm not saying it's absolute, but in some patients it is. So you can see that when we're doing this, it's not enough to just give these patients the nutritional things that we usually give for neurodegenerative diseases, including the amino acids to rebalance some of the neurotransmitters. But we have to look beyond that and treat the patient holistically. That's what I'm getting at.
And you were telling us earlier there's 112 references.
Yes, about hydration.
I mean,
and I also found numerous references about utilizing regenerative medicine after you straighten out all of these neuro problems. In other words, if we look at the gut and we help treat the gut and we help treat the neurotransmitters and we help treat the mitochondria dysfunction, we may want to look at regenerative medicine as something to use to help a Parkinson's patient in the long run improve their quality of life. We're not curing Parkinson's. It's not holy water, but I'll be darned, it may give the patient a better quality of life. And the earlier you get in, the more likely we're going to be able to help you.
And, you know, I was just wondering, do you get all 112? Which of those do you take?
Well, I tell you, you start out right away with all the anti-inflammatories, all the mitochondria helpers, and of course, glutathione is extremely important. CoQ10 is extremely important. And so we have an absolute protocol for this. We also look at helping patients balance their blood sugar levels because we don't want to have, we want to help them reduce other risks that can contribute to this ghastly disease, period, John. So it's not just, hey, this isn't a one-size-fits-all either.
Okay, we have, I believe it's Marie in Egg Harbor Township.
Oh, hi. Hi, Marie.
Hi, Dr. Molly. I have a quick question. My husband has polymyalgia. I want him to listen to this, too, because he doesn't want to ask the question, so I'm asking for him. He's on prednisone, and
Yes.
he hates it. He wants to get off the prednisone. They just found out that he has something called temporal arteries.
Yeah, in his head, yes. Uh-huh.
Yeah.
Does he have pain?
So he has
has
to
pain?
have Not much pain, but a soreness there.
Yeah,
so he has to find out. He has to have a biopsy and see what that's. It's something GCA they're looking for.
A protein.
And he was hoping to be weaned off the prednisone. And when they found this, they said, "Oh no, you have to stay on it, 20 milligrams." And he feels like it's doing all kinds of things to his body.
How old is? May I ask you a question? How old's your husband?
He's a very healthy 81 that's just retiring, still working. He's retiring at the end of the month.
You know, I hate hearing things like this. Yeah. You know, we work our whole life, and then you get hit with something like this.
He's been healthy all his life, and now this came on so fast.
Yeah.
And we're just wondering, prednisone. Is there any other medication or any other treatment?
Again, one of the things I would tell him is, first of all, you can't just stop prednisone, right?
Right.
Can't. You have to be weaned down. Now, he's an intelligent guy. He gets that. I would say he needs to go in and get a firm diagnosis, okay? That's really, really important. But this kind of condition, of course, is affecting his immune system, bottom line. Now, the prednisone, of course, helps in that area in that it turns the immune system off from causing your body to turn against itself. That's the whole point of this. But he needs to make sure that he gets the absolute diagnosis, because it could be some type of other autoimmune disorder that is causing some of these symptoms, and he really needs to make sure that he follows the conventional to make sure that they have a differential diagnosis. And at that point, I would be happy to set up the free consult and see if there's some nutritional things. And I would say anti-inflammatories without a doubt. And possibly we should look at his gut health too, without a doubt. Of course, the prednisone is masking all of that for the moment.
Right.
But I think he definitely needs to get in and get that differential diagnosis, and I hope that you agree with that. I mean, it has to be done because you don't know what you're treating at this point. That's the bottom line.
Well, now, when you said differential diagnosis, do you mean by a rheumatologist or by you?
I mean a differential diagnosis from the pathology that they're going to do on the biopsy.
Okay.
That's number one. And then you can talk about which specialty he should go to. I agree with you're thinking in the right direction. I'm sure my docs. Go ahead.
He does have a rheumatologist that he's going to.
Good.
But we're not sure ourselves of the diagnosis. Really.
That's right. And therein lies the rub. So you need to look. You need to look for that, Marie. God bless you, Marie, on your journey.
Thank you.
You take care.
Thank you. Thanks for the call, Marie.
Bye-bye. Therein lies the rub. And don't I hear more don't I get more patients like that after the diagnosis is made? And sometimes it's not so easy to do the diagnosis, exactly what's happened with my Parkinson's patient. But we know that inflammation is part of the culprit. So, would there be some things we could do for him? Absolutely. Absolutely. And I would say it would start with some of the anti-inflammatories, but I would want to use very specific kinds of things in that case, and I would want to collaborate with my two physicians on it.
Okay. Dr. Molly is very busy, but she's not too busy to attend a conference.
Yeah, I'm attending a conference in, and actually this is a traditional conference. I want everybody to know that I don't just go to things that are alternative or let's say holistic in nature, but I look at what's out there in terms of new developments, particularly in terms of biotech and everything, because I want to know about the new things that are out there. But this is a conference about plasma, and so plasma being God's gift to us, right? It's in our blood. I'm always very interested in plasma sourcing, and again, looking at the IgG that was given to my patient for a particular for the MS potentially. So I'm going out there and I really want to hear what's going on in terms of the biotech companies and all the new developments that they're doing, again, because plasma is one of God's ingredients. Now, it is true that the biotech companies engineer it, but, and there are synthetic derivatives and things, But it's the kind of thing that I want to know about, which is why I'm going out from late Monday afternoon. I'm going to be in the office on Monday morning. I'm out Tuesday and Wednesday, and I'll back in my office on Thursday morning. So it's going to be an interesting conference, and I hope I learn some new things that are going on. And generally, by the way, this type of conference is unique because there's a lot of scientists there talking about new types of treatment programs that are out for people, and it's always good to know about this.
And it's just adding another thing to your schedule.
Well,
right.
It's something I really want to, you want to keep abreast of these things, even conventionally as well as non-conventional.
We're coming up on a break. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is the number here in the studio, 855-839-1210, with Dr. Molly Fantasia. Again, I'm your host, John DeMasi. We are both coming back with more Health Watch after these words. We are back here on Health Watch, and again, operators are standing by right now at Innovative Medical Associates. And by the way, they will be there well after we leave you at 9 o'clock this morning. 856-489-0505. I'll give you that number again. 856-489-0505. And, of course, you can also check out the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. And if you miss any of today's show, you can tune in this afternoon at 4. We have our Health Watch replay, 4 to 5 this afternoon, here on Talk Radio 1210 WPHT. But right now, we'll take your calls at 855-839-1210. That's the number here in the studio. What's that saying, Dr. Molly? Physician, heal thyself?
Oh, yes. Yeah. So
I'm
allowed to talk about this case because it's Dr. Pat. Everybody knows she's my medical director who actually has MS. Well, I've been telling you she's been feeling so good, and she has. So about a week ago or so, she decided to take a stroll on one of the parks in Delaware that's on the beach. And she said she's going up one of these hills or one of these inclines, and she trips over a stone. And what does she do? She cracks her kneecap. So she calls. She actually was in on Tuesday, which is her regular day. And she came in, and guess what she did to herself? She did a PRP procedure on her own knee, and she also used the MSC cells that we do, the regenerative medicine cells, because she told the orthopod who treated her at urgent care, don't worry so much, I'm not doing the surgery, just stabilize it. And that's what she did. So she came in, and I said, listen, why don't you just stay off your feet for a couple of weeks, another week or so, and let Dr. Linda take over, who's our associate director. And she said, hey, that's fine, Dr. Molly, but don't forget to call me and let me know what's going on. So the bottom line is, I just want to say, I push our regenerative medicine because Dr. Pat is very, very good with that needle because she was an anesthesiologist. Well, she did it to herself, guys. So that should tell you something. We do believe in what we do, as you know, John. We're all in the chair, et cetera.
And she, of course, she was a mess.
Oh, when she came in, you should see how good she looks. She said, I can't stand being in this wheelchair. I said, I know, but don't put weight on that. So she is in a stabilizer, and I'm glad she is. But she isn't doing surgery. And therein is the message I'm giving people, that sometimes there's another bust. And I'm happy to say she's on the road to recovery.
And you can provide that for patients.
Oh, my gosh, of course. Yes. Of course. That's what I'm saying, John.
Give us an update, because usually at this point in the show, we kind of talk about patients and where they're going and where they're headed.
I had these patients in from Indiana. I treated 2 patients from Indiana and 1 from California this past week. And that's another reason why I was just trying to do the discharge summary. But my patient from Indiana came in extremely malnourished, extremely. I mean, he had multiple system problems. His hemoglobin and hematocrit was severely depressed, which made him totally anemic. He had malnutrition syndromes. He was an absolute mess. Skin problems, which probably was related to scurvy or some variation of that. No vitamins. I'm still waiting on one more test. But he had a serotonin level of below 11. That is extremely low. And it's interesting because his wife said one of the major issues seemed to be depression. Well, of course he has depression. A, he's malnourished. He hasn't been eating. He had an H. pylori infection that went untreated for a period of time, which contributes to ulcers. So he couldn't eat. He was having burning, etc. We sent him out for a full battery of radiology and tests to check and see that there wasn't anything we were missing, like any kind of problem with his esophagus, that kind of deal. We sent him out for particular challenges to look for hormonal dysregulation. Everything pretty much came back well, and we really could focus on the malnutrition. But I find it interesting. He's 33 years old, living an active life, and something triggered this. I would venture to say it was environmental because he's in a concrete business. He's probably taking in the fumes from the pouring. I would say it's more than likely started with some type of environmental toxin. And what happens is we're exposed. It's sort of like a glass of water. It's right to the brim. We keep getting exposed. So the water gets higher and higher and higher. And then it gets to the rim. And maybe one exposure makes it fall over the side, and that's when everything starts to cascade. So he's a patient. He went home. He had to go home a week early. I said that was okay. He's coming back before Christmas. I've been checking up on them by phone since he left on Wednesday. I know he actually left at the end of the week, so I've been checking up on him. I think he left Friday, and my next two left over the weekend. So bottom line is that I will keep you abreast about his outcome. But you've seen him, you saw him.
Yeah,
he looked pretty bad.
Yeah, I mean, 33 years old. You're saying that's so young. I mean, I don't understand that.
Well, John, I will tell you this: if you stop eating because you stop eating, you're not getting any nutrients. You think you're taking the vitamins. You're just not going to do it. I mean, medical hydration was an absolute mess. Necessary for this kind of case. So that was one of the cases. Then, of course, I had a pain case. The other case from there was a pain case, and I think it's really fibromyalgia. And again, it's an autoimmune. It's a mitochondria dysfunction. Another person who's a farmer out there. And again, you've got to look at toxic exposure, Lyme disease, that kind of thing. So,
we're going to try to get to this call before the end of the show. John in Bucks County. John, good morning.
John.
You're on Health Watch with Dr. Molly.
Hi, John. How are you?
Hi. How you doing, Doctor?
Good.
Hey, John.
Good.
Dr. Molly, I wanted to just thank you.
This is John, my pharmacist friend. Yeah.
Yes.
How are you, John?
You sent me. Well, I wish I could say I was better. Mom's in the hospital the last 2
Lord.
weeks. GI bleed, H. pylori. Yesterday I went to go see her. She got discharged, and I went to go see her at her memory care place. And I walk in, and she's unresponsive.
Oh my God, John! I'm so sorry.
No, thank you. No, I wanted to thank you.
You're more
and
than
I know
welcome.
you're super busy.
That doesn't matter.
I wish I could just take you and bring you to this hospital
I wish
and
I could go.
educate these doctors on the importance of hydration. Because I think she looks dehydrated. She has dementia. She looks dehydrated. I look at her labs every day,
Sure.
But I'm all about functional medicine or integrative medicine.
Of course.
So I've been looking at everything. I don't know what to do.
I
don't know
John,
what to suggest.
I mean, this is a terrible situation. I got to tell you, how long did she have the H. pylori that went untreated? Do you know? Because we know.
So we don't know.
Of course.
We don't know. And the thing is, she spits out her pills.
Of course.
And because of the dementia. So I'm like, the best thing right now is she's getting hydrated.
She is. Thank
her
God.
labs are
Thank
looking
God.
better.
Thank God.
But she doesn't. I'm wondering, I just want to ask you this question since I know you know more than me.
No,
if she's not eating and she's not hydrating, could this cause what's going on with her condition?
Well, don't you agree that it would? I mean, let's
Yes.
be logical about
Yes.
it. Of course. Now, the problem is, what can we do about it? I know, they won't take an order from somebody outside the clinic, your clinic.
No, that was a pain
wherever
in the
she
ass.
is.
Yeah,
Right,
sorry.
I know. That's
Sorry.
okay. No, man, it's true. They won't take an order from a functional doctor. You know that. It's unconscionable. And I will tell you, there's more and more data, John. Look at the data about people who have Alzheimer's and dehydration. It's incredible. I mean, this is conventional medicine. Forget about the things you and I do. This is conventional medicine. Why aren't they looking at this data? It's all over PubMed, okay? I mean, it's not just the European data. There's actual American data, too, which, they live and die by. So, I feel terrible because I know about this. I myself lost my mother very similarly. She was John can tell you, she walked to my office.
Oh, yeah,
Mama,
yeah.
Had a little problem in the hospital. Next thing I know, she's unresponsive. And unresponsive because she looked like she was totally dehydrated. In there for 2 weeks, nothing. No hydration, nothing. It was ridiculous.
John, thanks for the call.
God
we
bless
got to
you,
run.
John.
We're,
God bless you. And
coming
God bless your
up
mother.
against the clock.
You
so-
know what? We're going to be praying for his mother
Yes.
for a
And if
peaceful
you want to talk to
situation.
Dr. Molly, you can
He
call her in
knows.
the office.
He
Yeah,
knows.
yeah,
God
okay.
bless him.
That's going to put the wraps on another edition of Health Watch. Don't forget, operators standing by right now at Innovative Medical Associates, 856-489-0505, 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget our Health Watch replay this afternoon, 4 till 5 here on Talk Radio 1210 WPHD. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, our nursing staff, Barbara, Lana, Donna, Vicky, and Daniel. Then, of course, there's Joanne, fabulous Fran, delightful Dee, and our medical assistant, Sandra. I'm your host, John DeMasi. Thank you for listening. Have yourself a great week. We'll talk to you next Sunday, Health Watch here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.